Hey, man, I just can't believe, boy.
Yo, sweet boy, what you really crying for?
Why you see me crying, boy? My man crying. I just see her thinking about that girl. I think she cheating on me, you know.
You lie.
Boy, for real. A couple of weeks ago, right? She come telling me how I'm too sweet. And that I just make she belly roll and I got her thighs rubbing. What is that?
No, man.
But yes. Look, she tell me, right, that we need some time apart. To be honest, I wasn't too concerned about that because you know how the girls and them, they're addicted to me sweetness. But then I see she the other day and the girl looking so good, looking so fresh and so lean.
Boy, you sure she addicted to you?
But yes. But wait. Look at her. Come. Hide. Boy, come hide now. Oh, I can't believe, but is that what going on? Really? Why you got to say for yourself?
Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey.
Hello, good night everyone, and thank you for joining us this evening live on ZIZ TV, YouTube, and Facebook. We appreciate your time and attention for joining us on this panel discussion that we have this evening. And later this evening, we'd like to encourage your participation by submitting questions and joining the conversation. For tonight's discussion, we have a diverse panel of speakers from various sectors, and we'll be discussing the different ways that we each can play a role in tackling the NCD epidemic that we face here in St. Kitts and Nevis, as well as in the broader Caribbean region. So right now, I'll take the opportunity to introduce myself, as well as all the other persons we'll be hearing from this evening. So my name is Iseline Phillip. I am the Advocacy and Research Officer at Lake Health and Wellbeing, which is a public health NGO based here in St. Kitts. I will be your host and moderator for this evening. So first, I'd like to have the pleasure of introducing Dr. Marissa Catty, who is the NCD Program Coordinator for the Ministry of Health. Thank you, Dr. Catty, for joining us this evening. We also have joining us virtually a very familiar face. We have Dr. Al Peer, who is joining us in his capacity as the Vice President of the St. Kitts and Nevis Medical and Dental Association. Thank you, Dr. Peer, for joining us and connecting. Present here in the studio, we have, to share ideas from the perspective of the media, Mr. Andre Huey, who is the News Director for SKN Newsline. Thank you, Andre, for being here. Next, we have Pastor Philip Webb, who is a member of the Evangelical Association, to share his thoughts on how the church actually plays its own part in promoting healthy lifestyles. Thank you, Pastor Webb, for joining us. And finally, of course, but not least at all, we have a youth advocate this evening, Mr. Jelani Bell, who is a member of the St. Kitts National Youth Parliament Association. So thank you all very much for accepting my invitation to join us on this panel this evening. I really believe and hope that we have very interesting and insightful conversation and discussion. So, as I mentioned, what we're talking about this evening is non-communicable diseases and really finding out ways that we can all work together to prevent and control and combat and tackle this epidemic that we're hearing about and that we know that exists. So I want to actually start with Dr. Catty this evening and ask her to tell us actually what non-communicable diseases are. We also know them to be called NCDs. So Dr. Catty, if you can tell us what are NCDs and why exactly are they so concerning for us here as a nation and as also for the Ministry of Health as a priority area?
A pleasant good night to everyone who's listening, and thank you, Iseline, for the opportunity to share this information this evening. Now, non-communicable diseases are medical conditions which are considered not infectious, meaning that they are not passed from person to person. If you think about the COVID-19 pandemic, for example, or virus, that can be passed from person to person, so that is considered communicable or infectious. But with non-communicable diseases, these conditions are not passed from person to person. Other characteristics of non-communicable diseases are that they are very slow to progress, meaning that they develop over time and they don't come upon you suddenly. For example, now some persons might consider a heart attack, for example, something sudden. However, the underlying conditions that can lead to a heart attack can be slow progressing, and that is why cardiac conditions are considered non-communicable diseases. Other characteristics include that they are long in duration, and that is where the term chronic comes from. So therefore, they can last over a lifetime. And then additionally, they can cause premature illness, dysfunction, and reduce quality of life. And then finally, non-communicable diseases can also lead to death. As a matter of fact, globally, NCDs are the leading cause of death, and they are actually attributed to over 40 million persons dying from NCDs. Now, there are 4 main types of NCDs. We have the cardiovascular diseases, so these include coronary heart disease and stroke. We have our cancers, diabetes, and chronic respiratory or lung diseases. And these include things like asthma, conditions like asthma, and chronic obstructive pulmonary diseases. Other conditions that are now being considered as non-communicable diseases include chronic mental illness, and within the Caribbean region, we are also now considering sickle cell disease as a part of that NCD list. Now, of course, these are not the only chronic diseases that we have, but other conditions include chronic neurological disorders such as Alzheimer's or dementia, as well as arthritis and musculoskeletal diseases. So these are all conditions that are considered chronic. Now, the question is, why are non-communicable diseases so important to us? And one of the reasons for their importance is the burden that they bear on our society. Non-communicable diseases are generally linked to low-income communities. For example, persons who are not able to afford proper nutrition are generally at risk of developing non-communicable diseases. And research has shown that over the years there has been a rapid rise in non-communicable diseases within these low-income communities. Additionally, non-communicable diseases bear a very high healthcare cost. And you can imagine that this would also be an issue for persons in low-income communities because they already are not able to afford proper health care. And so this is one of the reasons why non-communicable diseases or chronic conditions are such a burden on the society. Their healthcare costs and the fact that they affect mainly persons in low-income communities.
Thank you very much, Dr. Cathy. There's quite a bit of information that you shared there, and kind of want to pull out and highlight some of the things that you mentioned, for people to make sure you get that, chronic NCDs are, obviously illnesses that, as you say, are not transmitted. They're not infectious. So that's important to note, and that they come on as a part of kind of lifestyle in terms of lifestyle environment, and they typically take some time to develop. And you mentioned the burden that they bear on society as to particularly why it can be so concerning for us. And so one of the things, we have Dr. Pierre who's on the line, and as a doctor, as a medical professional, Dr. Pierre, you work on the front lines, and you have colleagues who similarly work on the front lines. So maybe you would be able to tell us a little bit more about what you see in terms of what your perspective is in terms of NCDs and persons who may come to you within your field of work. What is that like? What is that experience like for you on the front line? What are your concerns around NCDs as a medical professional?
Hi, thanks again. I'm getting some feedback, so let me know if you can hear me properly. I'm joining virtually. It's my first time doing that, so I just want to be sure that what I say can be heard. So thanks for your questions, and thanks again for having me as part of the panel for such an important topic, such a consequential topic. And it's consequential because until recently, and I say as recent as a year and a half ago, before COVID made its way to our shores, NCDs were top of mind in terms of the number one cause of death, not just in St. Kitts and the Caribbean, but the world over. In fact, I've told people, many times when I actually do discussions about vaccines, I tell people that until now, infectious diseases have not been an existential threat to human beings. It's really been NCDs that has been really top of mind for me as a medical practitioner. And why is that? Why is that the case, right? It's because 71% of all deaths globally, 71%, just think about it, are caused by NCDs. 41 million people every year lose their life to NCDs, right, on average. And the reality of it is that 77%, and just to underscore a point that Dr. Kathy made, is that 77% of these NCDs are happening the deaths rather, are happening in low and middle income countries, which of which the Caribbean is considered part of this. So let's just stick a pin here and just think of this very, very sobering reminders, right, of the number of individuals who are losing their life every single year to NCDs. I think if we just look around ourselves, within our immediate families, I think we all know somebody, right, and people who are very close to us who either suffer from one of those NCDs that Dr. Carty listed, whether it's a neurological disorder, which is less common, but hypertension, which is far more common in our setting, diabetes. And it is sometimes a very difficult thing to manage. One, because many of those things are lifestyle diseases, right? And it's one of the very difficult things to do is to get individuals to change their lifestyle. So that's one of the greatest challenges that we face. And I liked when you send the information out, you made mention of an all of society approach. And it really is an all of society approach, because the fact is, this burden of disease that we spoke about, and Dr. Carty mentioned, it's a burden on all of us, but it's actually a statistical figure in the form of burden of disease. What does that mean when you speak of the burden of NCDs? It means that this disease has a particular impact. It's a health problem, and it actually has financial metrics by which it can be measured. There are mortality and morbidity metrics, which means that the number of people actually die or get very sick, and there are other indicators. As a medical practitioner, for me, I think the most the greatest challenge I have is to look at one of the indices that I don't think is spoken about nearly enough, which is disability adjusted life years. What that means is that there are a number of individuals who are still alive but not productive. And that's the consequence of NCDs. And that for me is to see the 47-year-old woman, right, 47 years old, who is at the prime of her life, who has diabetes, hypertension, who has had a pulmonary embolism, who is morbidly obese, and has been on disability for 5 years already. So this is somebody who at the age of 42 cannot be gainfully employed, and if they do, in a very, very limited fashion. So as a medical practitioner, and I have a colleague of mine who likes to say it takes cash to care. If you have somebody who's at the age of 42, imagine a mother or a father who at 42 is just trying to save some money to provide the type of education that their kids deserve and need. And that person has to be on disability. Imagine the impact that does, not only to the individual themselves, but all of society. The family who now has to step in to pay for the medication, pay for the healthcare, the quality of life of the kids that are involved, right? If that person is gainfully employed, just think of the number of sick days that person takes, how unproductive they become. And just think of the burden on the healthcare system overall, especially in settings like ours, where the government foots the majority of the bill. So, those are the things that I think about. And yes, we can get down to into the day-to-day aspects of caring for individuals with NCDs, but it's very difficult for me not to think of the ripple effects of those diseases when individuals are getting sick so much earlier and they are becoming disabled. They are alive, but what I always say is that they have a lot more years in their life than life in their years, right?
There's some very interesting points there, Dr. Pierre, and I kind of wanted to to add. So, you know, we have the global figure, the global statistic in terms of NCDs being the major cause of death. It's at 71% globally. But just to give people an understanding and a context, so I think, and Dr. Kathy can always confirm, but I believe the statistic for St. Kitts and Nevis in terms of the percentage, the prevalence of NCDs of death being attributed to NCDs is 83%. So 83% of deaths in St. Kitts and Nevis are attributed to a non-communicable disease. And, you know, I do believe, I agree with you, Dr. Pierre, that, you know, it is quite alarming. And I think that's where, you know, the work of Lake Health and Wellbeing as a civil society organization, that's why we think it's very important, you know, to spread public awareness and to do education and whatever projects and interventions and to collaborate to make sure that we can find ways of actually tackling this problem. Because what you're talking about, Dr. Pierre, is we're actually talking about, you know, threats to our sustainability as a people. And I think, you know, that's really important for us to think about when we think about the burden of non-communicable diseases, especially when we hear about rates of obesity that are on the rise, and also the prevalence rate of diabetes, which I believe is 23%, as well as for hypertension, which is 35%. And these are very high statistics, and this is just based on public health research that we do as an organization and that we find. So, you know, one of the things that you know, as a civil society organization and, you know, others, if working with others, we'd want to find ways of how we can actually work together on what we can do. What can we do? We know this is a major problem, so that's kind of brings us here this evening. And so I kind of want to kick off that and go to Mr. Huey, who is, you know, a media professional. And one of the things that we find, so this week we're talking about, this is Drink Water Week, and one of the things that we know is when it comes to the consumption, high consumption rates of sugary drinks is something that we know is typically linked to the development of overweight, obesity, and the development of diabetes because of the high consumption of sugary beverages. So one of the things that we recognize working in this space is that unhealthy beverages and foods, they're often advertised in the media to children and to adults. And so we kind of want to know, well, Mr. Huey, what role do you think the media plays when it comes to either contributing or combating non-communicable diseases, you know? So what space? Because the media is very influential. So can you tell us a little bit about what your thoughts are in terms of the role the media plays?
Yeah, well, thank you for that question. Well, yes, you're absolutely right. The media does play a very important role, a very influential role when it comes to the messages that are transmitted, whether through broadcast means, print, digital, and there are so many forms of media today. One of the things that I think we have to also understand is how advertising and marketing works. Because in the media landscape, you have the aspect of news and information, and you also have the aspect, which is also the engine of especially traditional media, which is advertising and marketing. And that is a two-way street. It is not just the media that just broadcasts these images or these advertisements. It is also the entities that own and operate these brands that put out manufacture these sugary drinks that have a marked interest in marketing their product. So you have a situation where it's a chicken and egg situation, you could say basically, where the media needs the advertising dollars and the entity that are manufacturing these sugary drinks need the exposure. And so, you know, the two become one in a sense. What I find fascinating though, where the whole thing is concerned, we compare sugary drinks to water, which we know is very important and is the far better, healthier option. We don't find the manufacturers of or the distributors of water having an interest in marketing their product. And I think because they take it for granted that, you know, people need water, so why do I need to advertise? But the manufacturers of the sugary drinks, they're putting their product out there in the face of everybody. And they understand the importance of marketing and branding. And I think, you know, it is time for maybe even some of the entities that manufacture water to have a different approach. Not just take it for granted that everyone is going to drink water and so you don't need to advertise. Because the other food manufacturers, they're going to put their product there at the center. Not only in advertising, but also sponsoring events, sponsoring sporting events, sponsoring activities that they know there are a lot of people will be coming around and you know, their product will get more exposure and be sold more. So I think there has to be a paradigm shift from the point of view of persons who are manufacturing and distributing water, for example, and I'm just using that as an example, to have a marked interest in marketing their product and branding their product, because the other manufacturers that manufacture drinks or goods or food items that may not be as healthy as water and other products, they see the importance of branding and marketing. So the media does have a role. And I mean, later on, we can also look at some of the ways in which that can happen. But there can be a partnership between those who need to get that message out, as well as the media, working along with the media. It's not going to happen just by one entity just doing it all by themselves.
And I think you definitely raised the point that I don't think we all often consider when we think about, seeing these things in the media. We often just attribute it to, we're seeing this on TV, we're hearing it on the radio. But, you talk about the role of industry. So the industry, the manufacturers, and that is something definitely that we find when we're working in the civil society space. That's really a challenge for us, where we have industry interference. As much as we try to promote messages around healthy drinking and healthy eating, we have these huge conglomerates, these huge businesses and companies that can afford to pay media houses and to pay for the marketing of these products that are actually not healthy for us, and that's contributing to these non-communicable diseases in ways that are really disadvantageous and not beneficial. And so, I take your point, in terms of, alternatively with the, water companies and other companies being able to step up to do more when it comes to, as you say, sponsoring events and also doing that kind of marketing. Because I would agree in terms of, you typically think, oh, water, it's kind of essential. People are going to buy water regardless. Right. We don't have to advertise water. But that is an interesting point, because on the other side, we obviously clearly see we're bombarded by advertising and marketing of unhealthy products, and the way that it's done, it's particularly done in a way that actually draws persons in, especially children and young people, which we're actually particularly concerned about when it comes to rising rates of childhood obesity, and we're seeing younger and younger persons developing some of these chronic illnesses. So that's really interesting to note, and we'll kind of come back to Mr. Hugh on kind of finding ways and how we can, perhaps mobilize the media in different ways. So I kind of want to move on and, touch Pastor Webb a little bit and invite him to give us a little bit of perspective now. We know when it comes to being healthy and promoting health and wellness, I think the church is very central to our societies, particularly Caribbean society. It's still very central to who we are as a people. There are a lot of persons who subscribe to Christianity. And so, Pastor Webb, do you think the church and spiritual leaders have a role to play when it comes to promoting healthy lifestyles and combating and tackling non-communicable diseases?
Yes, let me first and foremost say a pleasant good night to all the panelists and all the viewers, and I also give honor to Almighty God, because without Him I won't have the breath of life to be breathing tonight. Yes, the church have a vital role to play in the non-communicable disease, the NCDs. I believe that the church is an essential body, and so you have a vital role to play to help to combat these diseases that is on the market today. And the church, of course, is not the building. The church is the people. And the building is just to facilitate the ministry of worship, etc. And so, as a church, we believe that we have a vital role to play. So we have programs to help to combat diseases of this nature, whereby the Bible, in fact, tells us in the book of 3 John, verse 2, it said, "I wish above all that thou mayest prosper and be in health, even as thy soul prospereth." And so the Bible teaches us about a healthy lifestyle. So we are to promote a healthy lifestyle, especially in times like these, as one of the leading cause of death, is hypertension, high blood pressure, and this is a silent killer. So it is imperative that we be able to tackle this problem. But we have to change our eating habits, bad eating habits, because a bad eating habit is just like a flat tire. It can't get you nowhere unless you change it. And so we promote a healthy lifestyle by eating healthy from God's pharmacy. Because back in Genesis, it's interesting that God created a garden and made land and sea way before he made man. So he provided a garden. And when you look at even grapes, which is a very important food to eat that could help combat the problem of high blood pressure, etc. If you notice that grapes, it hang in a cluster, and each grape look like a cell. And so all the different cells in the human body, you have the platelet cells, the plasma cells, you have the white blood cell, the red blood cell, and each grape, represent, a cell. So scientists also, proven that eating grapes is it helped protect you from heart disease and stuff like that, and hypertension. And well, when I talk about eating grapes too, I would suggest that eating grapes that is without seed, because we now living in a seedless society. Everybody want something without seed, and to eliminate the seed out of grapes or any other kind of fruit, is not, I wouldn't consider it to be healthy, because God provide everything with seeds. And so even tomato, we promote eating healthy, like eating from God's pharmacy, like the tomato. You look at a tomato have 4 chambers and is red. And the heart have 4 chambers, and the heart is also red. So tomato is a blood vitalizing food that will help, to combat diseases such as high blood pressure and stuff like that, which is a silent killer. So we promote a healthy lifestyle. The other day we had what you call another symposium, and we had a night session where we promote a healthy lifestyle, and we had a guest, and stuff like that to help promote a healthy lifestyle. So I believe that the church have a vital role to play. Not only that, we use the technology in terms of with the media. We provide a radio program that will promote a healthy lifestyle, and so we as a church, believe that we have a vital role to play in healthy lifestyle.
Very much, Pastor Webb. It's really good to have you join the panel, because you're kind of giving us the spiritual interpretation of what it means to be healthy, and as somebody who is spiritual themselves, we know that we're called to take care of God's temple, and that's part of it, as you say, making sure that we feed ourselves and nourish ourselves with the natural foods that grow, that grow on the earth that's provided. And so it's really good to hear just the ways that you're able to link spirituality to being healthy and promoting healthy lifestyles. So, we'll definitely come back a little bit to hear about some other initiatives that you mentioned in terms of what the church and what, persons in the Evangelical Association are doing to help educate and do that kind of education and information to help encourage people to be healthy and do better. But it's really good to know that the church plays that very essential role in trying to really promote and help people to understand that being healthy and eating well is also spiritually enriching for them as well. So thank you for that. Now, we have Mr. Jelani Bell. So you, as our youth advocate, we know, so one of the things that I can say, statistics, I've always got the statistics in the back of my head. Research is something that I spend quite a lot of time doing. So statistically we know that when it comes to childhood obesity, we're seeing rates on the rise. In St. Kitts and Nevis, the prevalence rate for childhood obesity is 33%, which equates to every 1 in 3 children is considered either overweight or obese. Now, as a youth advocate and noting these statistics, is this particularly alarming to you? So for young people, the future of the nation obviously rests in your hands. Is this particularly alarming? What are your own views in terms of the NCD epidemic and what you're hearing and what you've heard so far, just in terms of where we are at as a society and even as a region and globally when it comes to non-communicable diseases and the threat that it places on us and on our parents who may have NCDs, because then the burden becomes on us as the young people to take care of parents who lose their productivity, as Dr. Pierre was mentioning. So is this alarming to you? And what are your views on it?
Well, thank you, Aislinn, for that question. In the long and short, it is very alarming because a lot of our young people now these days are facing obesity. And the consumption of these sugary drinks, as Dr. Pierre said, it's a lifestyle decision that they make. And with that lifestyle decision constantly being made, it affects the outcome of the individuals. So for them to be able to provide for the future, it's a problem because they then are disabled at a very early age. So they're not providing for the economy, they're not providing for their families in the future, and then they put a burden on the government to take care of these individuals. So it is very alarming to see a lot of young people going through these NCDs, and it is extremely shocking to see that we have 33% of young individuals undergoing these NCDs. So to me, yes, it is a problem that we have to face.
Come back to you just in terms of finding out what you think we should do. So we have a problem, and obviously as young people and as youth advocates, solutions, the innovative solutions, typically we try to find out from you. So but we'll circle back. I want to turn again to Dr. Cathy. So we've heard a little bit about what different sectors are doing, but we know, as you mentioned, Dr. Cathy, this is a priority, and recognizing because of the burden that it places on us as a society and on the government, because we have to obviously, I believe, quite a bit of health expenditure goes into treating persons with non-communicable diseases. So can you tell me a little bit about how the Ministry of Health and the government extended what is being done in terms of finding programs or initiatives to prevent and control the development of non-communicable diseases, and particularly in terms of public consumption of sugar-sweetened beverages, which we know is one of the leading factors to contributing to obesity, which as a risk factor for NCDs.
Mm-hmm. Okay, thank you, Aislinn. So one of the main pillars of the NCD program is prevention. And this is being able to provide information to the public about how best they can develop or maintain healthy habits in order to live a healthy life. Now, in order for us to do this, we have to consider putting in place certain programs and even the development of certain policies in order to accomplish this. Two of the programs I will mention now would be our chronic disease self-management program. Now, this program is actually a community-based program that is designed to teach persons living with chronic diseases, as well as their caregivers, certain techniques and tools that they can use to help to build confidence in their ability to manage their own conditions. One of the things that is stressed in this program, for example, is just the ability to be able to speak to your general practitioner. Condition, being educated about what is going on with you so that you are better able to manage your condition. So that's one of the programs we have, which is the chronic disease self-management program. Another program that we have instituted just recently, as a matter of fact, it was launched in 2019, is our SKN Moves Program, of which this week of activities is a part, so we're very happy for that. Now, the SKN Moves initiative is actually a program that would help us here within the Federation of St. Kitts and Nevis to create a healthy lifestyle culture. And that culture is going to be based on 3 pillars, which is healthy eating and drinking, regular physical activity, and then regular health screenings. We do understand that eating healthy is very important, and being able to make those healthy choices is important. And so the Skn Moves Program will be used to help to educate persons on those areas. The nutrition program within the Health Promotion Unit of the Ministry of Health works along with the NCD program in this aspect. And then, of course, we have the physical activity, encouraging persons, the importance of moving, just getting moving. And moving can be in any form, whether it's going out into your garden, doing some gardening, whether it's cycling, just walking along a path. Anything that will allow you to get up and get moving will help to also reduce the impact of non-communicable diseases. And then most importantly, the health screenings. Early detection of certain conditions or certain risk factors within an individual can also help to prevent the onset and also the progression of certain conditions. And so health screening, seeing your medical practitioner at least once per year, getting that yearly checkup is very, very important. But Iselin, before I finish, I want to also point out one other important aspect of the NCD program, and that is the development of policies. Fiscal policies are actually health promotion measures that can be implemented from a government perspective to help to manage the burden of NCDs within a particular country. As a matter of fact, the World Health Organization encourages the use of fiscal policies to encourage healthy behaviors within member states. A fiscal policy can include recommendations such as taxations, subsidies, provisions of specific health services, regulations for advertising, promotion, and labeling, as was mentioned by our media professional on this side there, as well as regulations on certain consumables such as what we eat, drink, and even smoke. And one of the most important aspects of a fiscal policy is population education. It is very important, and in order for us to be able to develop a fiscal policy, we must get the feedback of the population. Right now, the Ministry of Health is in the process of developing the sugar-sweetened beverage policy. We have had those population education sessions. As a matter of fact, in 2017, one of the first things we did was we conducted a food store survey where we went around to a number of grocery stores, supermarkets, to see what the types of sugar-sweetened beverages that are being sold within the Federation. And then we also held town hall sessions, one in St. Kitts and one in Nevis, to get feedback from the public, as well as focus group sessions with various stakeholders, such as food handlers, persons, distributors, even persons from the Bureau of Standards, in order to get their feedback as well as to some of the policy imperatives and recommendations that we are considering for the sugar-sweetened beverage policy. So right now, we have already drafted the first draft of the policy, and it is currently in the review stage. So those are some of the things that the Ministry of Health is doing in our efforts to reduce the impact of non-communicable diseases in the Federation.
Great. Thank you so much, Dr. Cathy. I'm always very pleased to hear about policy development, because that's the space that I'm very familiar with and that I work in. And, as, for us at Lake Health and Wellbeing, we're big advocates for and supporters of, the development of the SSB policy that we know the Ministry of Health has drafted, is in the process of approving and having reviewed. And so, I want to, we'll talk a little bit about about some of the policies that you may have mentioned, that you did mention, but I want to ask Dr. Pierce, since, he's on the front line, and we hear all these things that the Ministry of Health is doing in terms of interventions, programs, initiatives, and of course policies, which are all very important, which are all necessary. But from your perspective, Dr. Pierce, since you as a medical practitioner, where do you find the challenge is really, especially when it comes to patients? And you have patients. I think times of conversations that we've had before, you've talked about you have the revolving door, and so what types of interventions do you think are most needed at this point in time, based on your experience of treating patients or having to treat patients multiple times for the same things? What would be the recommendation of medical practitioners based on what to be true working on the front line with patients with these diseases? What do you think would be most effective? What would be your recommendations?
Thanks, great question. And I think I just want to touch on some points of some of the panelists. For example, Pastor Webb, who spoke to the fact that, as you articulated, spoke to the spiritual aspect of NCDs and why they matter. And I think you sort of summarized this quite nicely by referring to the body as the temple of the Lord. And I don't know that any of us would worship in a temple that is unkempt and disorderly and disorganized. So it's fascinating to see sometimes what we consume. It's fascinating to see the state in which we keep our health, and expect this is the place that God resides or worships. And I don't want to get into the too spiritual thing, because that's not my forte. But one of the things I do think is important, and here's the challenge we face. The challenge we face is that I spoke earlier of the fact that these are lifestyle diseases. Lifestyle meaning that they develop slowly and over time. So the child, for example, a young child in your house who is used to eating a high carb meal, or perhaps has been rewarded with pizza or whatever, or the fast food or whatever other meal that child is rewarded with, that is now the reward. That those foods are now attacking the reward centers of that child. Imagine that child who now has his or her own source of income and can now reward themselves on the daily with those meals. What's going to happen? It's going to be very difficult to separate these individuals from their style of eating. I could speak ad nauseum. This one touch sort of interaction that I have with someone in an emergency room or in the hospital alongside their bed. At that point, when people are sick, they will commit to anything. The minute they start feeling better, they go back to what is natural. And that's why it's so important to engage the rest of civil society to continue to reinforce those things. So the media, for example, drinking water is an essential thing to be airing, right? The church is a microcosm of the rest of society. The church is known for its community aspect. And I've always said to myself that the church is perhaps the place where there should be a farmer's market, where people have access to healthier. The church perhaps should invest in a farm and get individuals to go there, plant, and then, because one of the things that makes it challenging for individuals is the cost of eating healthy. Most individuals cannot afford to eat healthy, right? It's very difficult if you have 5 kids at home and you tell them eat broccoli or spinach, right? That doesn't fill anyone's belly. That's the reality we face. So sometimes we have to look at the socio-economic determinants of health, or the social determinants of health, right? That somebody who lives on average income or below average income has a challenge going every day and buying the things that we consider to be healthy, because one, they're not readily accessible, and they're too costly. So the question is, how can we engage the rest of civil society to offset some of those costs? How can we engage? How can the church invite us as medical practitioners into their congregation more often? Not ever so often that there's a diabetic day or hypertensive day, but with some degree of regularity to continue to bring that message home, to drive that point home. And not just medical doctors, I'm talking about nurses and talking about individuals like yourself, but the importance, the reality is that we have to take this seriously. And here's why it matters to me as a medical practitioner. We cannot appropriately treat a number of those diseases because we do not have the type of specialized care that is required for it. A person who has a stroke or a heart attack, the door to needle time, the time between the person gets that stroke and gets a needle in them with the right medication that is to happen is usually 0 to 30 minutes. Which means that ambulance needs to pick up that person, get them in, and there must be a medication to actually treat somebody who has a stroke and has a clot, or somebody who has a heart attack. We don't have a cardiac center, or we don't have a stroke center, and maybe we never will because our economy does not allow for it. So curative health is not going to solve our problem. It has to be preventative. We have to go back to the basic things. We have to engage our practitioners, like Dr. Carty said, with more regularity, right? We have to get everyone on board, everyone, for the gentleman here from the Youth Parliament. This is where we have to start working before it's broken. Because once it's broken, once somebody starts with hypertension, by the time you've told somebody they've had hypertension, they've already had it for 5 or 10 years. Right? Because the heart begins to accommodate and the cardiovascular system remodels itself to accommodate this. And by the time all the complications start setting in, like heart failure, and the same thing for diabetes. By the time you tell someone that they're diabetic, the end organ damage, the kidney, the retina, all the other pathways, the nephropathy, the neuropathy, has already begun to set in. And at that point, all you're trying to do is prevent the complications. So as medical practitioners, our job, the job of the Medical and Dental Association, is to ensure that our members are equipped with the right information, up-to-date information, because those things evolve over time. But I think it's really important for us to recognize that it's impossible for doctors to do this alone, nurses to do this alone, or Dr. Carty to take this on her own, or for you, I still at Lincoln Health and Wellness, or Pastor Webb. We have to come together. The question is, how can this be the start of something, of a movement? SKN moves, and we should all move together, because the challenges and this revolving door syndrome that we see is because this one-touch interaction and when somebody's ill makes no real impact. It doesn't make much of a dent. I've seen individuals who have a stroke and they're drinking, can barely hold the bottle. One side of the body, there's a hemiparesis, which means that they've lost a muscular strength in one side. They're holding the beer in the other. How do you separate individuals from this? The reality, and we spoke about it when I did a show recently about why sugar is so addictive. Sugar is 10, 50, 100 times more addictive than cocaine. Right? So those foods that we eat, those sugary beverages, the carbohydrates that we eat, it's addictive. It is an addiction. So we have to treat it like any other type of addiction with a whole of society approach. And I think that's where we need to start. The question is, how do we come together? How do we meet offline and then begin to work together on this?
And always when you speak about this issue, because I know you see it, you live it, and you definitely want to make a change around it. So, I take your point in terms of collaboration, which is why I thought it was important for us to meet like this on a panel like this with different sectors, and that's reiterating the importance of this topic that we have this evening in terms of an all of society approach and opening up the conversation, which is really what we're here trying to do. I think what we'll do, we'll take a quick break and then we'll come back and kind of reiterate some of those points and then talk a little bit about more of what you said in terms of how can we actually work together and what we can do. So we'll take a quick break, and please stay tuned and come back with us. We'll take a quick break and come back. Thank you.
Hey, man, I just can't believe that.
Yo, sweet boy, what you really crying for?
Why you see me crying, boy? My man crying. I just see her thinking about that girl. I think she cheating on me,
You lie.
Boy, for real. A couple of weeks ago, right? She come telling me how I'm too sweet and that I just make she belly roll and I got her thighs rubbing. What is that?
No, man.
But yes. Look, she tell me, right, that we need some time apart. To be honest, I wasn't too concerned about that because you know how the girls and them, they're addicted to me sweetness. But then I see she the other day and the girl looking so good, looking so fresh and so lean.
Boy, you sure she addicted to you?
But yes. But wait. Look at here. Come. Hide. Boy, come hide now. Oh, I can't believe. But is that what going on? Really? Why you got to say for yourself?
Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
Hello, good night. Welcome back to our panel discussion this evening, where we are talking about an all-of-society approach to tackling non-communicable diseases and promoting healthy drinking and eating. And if you've just joined us tonight, we have a diverse panel of speakers, of representatives from different sectors, including the Ministry of Health, the Medical and Dental Association, the Evangelical Association, the Youth Parliament, as well as the media. So just before we went on break, we heard from Dr. Pierre, who is the Vice President of the St. Kitts Medical and Dental Association, and he mentioned a few points that in terms of what we need to do, in terms of the kind of collaboration that needs to take place when it comes to really combating the challenges we see with non-communicable diseases. And, you know, during the break, Dr. Cathy echoed that sentiment, because I think oftentimes people think, oh, whenever it comes to public health issues, that it's the government, and it's just the government. And while obviously the government plays a very important role, especially when it comes to policy development and implementation, civil society is also very important, and all of us play a role in making sure that we can support each other and work with each other to make sure that we are not only taking a responsibility for ourselves and holding each other accountable, but also making sure that we can educate, spread that awareness that is necessary, and also in promoting the kinds of lifestyle choices and helping to shift that culture, because that's really what we need to happen. What we need to see is healthier food environments that can be promoted through some of the policy initiatives that Dr. Cathy mentioned. She mentioned some fiscal policies like consumption taxation, so that would be things like placing a tax on sugary drinks, things like restrictions to the sale and marketing of certain unhealthy food and beverages, in implementing front-of-pack labeling, which would then empower consumers to make healthier choices. So these are the types of policy initiatives that have been discussed, that have been recommended to try to see how we can create healthier food environments. But beyond the policy scope, which is government, we do have a role to play as civil society, as other organizations like the media, like the church, like youth advocacy, to make sure that we can promote an education, awareness, as well as to make sure that we can help to shift culture when it comes to our tastes, help to shift culture when it comes to the types of foods that we eat, and just the lifestyle choices that we make. So I want to pose a question now on to Mr. Huey, who was our representative for the media, and ask, we know that the media is very influential. We mentioned that, and there are obviously ways that companies themselves can utilize the media to promote, perhaps healthier products. But how do you think the media can work? How can we work with the media? How can other sectors of society work with the media to promote healthier lifestyles, to promote healthy drinking, and to say combat non-communicable diseases? Have you given this much thought? What are your thoughts on that?
Yeah. Well, I have several ideas, but I just want to drive home a point that I made earlier, and which you made reference to, Aislinn, about marketing. Because, I keep bringing home the point, and I think, ZIZ and other media houses will thank me for this, because I don't think that entities understand, here in St. Kitts Nevis, understand the power of marketing. A lot of the brands that we talk about, I'm not going to call any names, a lot of the major brands that market food and beverages that are considered unhealthy, they don't necessarily need to advertise per se, because they are so well known that, anyone walk into a supermarket, they want a particular drink, they will go in and get it. But they don't cut their advertising budget by no means. They, in fact, increase their advertising budget because they understand the power of branding and marketing. They understand that when somebody's thirsty, rather than picking up a bottle of water, they will go for that particular drink because it's always in your face. You drive along the road, you see a billboard, it's there. You watch on TV, it's there. You listen to the radio, you hear them. And that power of marketing and branding is something that I think more entities and companies here need to understand and appreciate, because it really, really works. If you want to get your message out there, if you want people to buy your product, you need to advertise. That's just the bottom line. So I just want to make that point there, and to segue into the point that for us to get the message of healthy eating there more, we will have to do more in that aspect as well, in terms of branding and marketing. But there are other ways as well, and some of the other ways require, I think, a partnership between the media and entities or organizations that are promoting healthy eating. So the Ministry of Health, for example, and other entities, other NGOs that are pushing the importance of eating healthy and a healthy lifestyle. So there has to be a partnership. So I think there maybe needs to be a sitting down of sorts between both entities, the media and those organizations, to come up with a marketing strategy and a public relations strategy where you can get that message across. Other ways in which I think that can be done as well is utilize the tools that are already available via the media. We talk about talk shows. These are programs that encourage public engagement, and that's one of the best ways in which you can reach out to people. So maybe having a more regular presence on talk shows and creating programs like this one, for example, and other similar programs on a consistent basis where you can actually you can focus entirely on healthy eating and getting the message across, interacting with people, getting their views as well. Dr. Perry raised some really important points about the cost of eating healthy. And of course, there are a lot of discussions about having your backyard garden or putting more focus on agriculture. We need to sort of flesh these issues out more and sort of get in, more public involvement in that regard. And lastly, I think also from a journalistic standpoint, there needs to be some more stories being done on healthy eating. There's a lot of moving parts as it relates to why is it that eating healthy is more expensive than buying unhealthy food? Why is it that we're not growing more food here? What are some of the challenges that are preventing farmers and people in the agriculture sector to create or to produce more food locally that would be healthier, the healthier choice? All these different things. Now, I know from a newsroom perspective, these stories are not necessarily, quote unquote, as we say in the media landscape, sexy when you compare to other stories, maybe on the political front or maybe even the COVID-19 pandemic. But I think there are a lot of linkages that can be made, and just a matter of newsrooms putting their heads together and looking at certain issues. And I think some of the organizations as well would need to make themselves more available to the media so that these stories can be told. Because, yes, as journalists, we are expected to go out and cover these stories. But if the people who are at the front line of promoting healthy eating are not making themselves available to the media, to be able to tackle these stories, it makes it a little bit more harder. So I think the Ministry of Health, Department of Health, people within the advocacy of eating healthy probably need to make themselves a little bit more available, more so that the media can actually do more stories on healthy eating. But so these are just some of the examples I think that we can look at to help promote that the mantra of healthy eating.
Thank you very much for that, and I really appreciate the points that you made there. You made some interesting, very good points there. And, you know, just the point on marketing, too. I think we recognize that, obviously, you know, these big manufacturers, they have the money to market, even though they don't need to, and they push that very often. And so that's why we mentioned the policy around, you know, restrictions on the sale and marketing of certain unhealthy drinks, especially when it comes to our school environments and where that's really pushed a lot towards our children. So that would be, you know, one type policy initiative where we try to curtail some of that marketing and restrict some of that. And I think you made a point, you know, I think one of the challenges that I know, you know, as NGOs and as civil society organizations that we face, it's not that we don't want to get out in the media, but airtime costs money, and we don't have the money, right? And so, you know, I'm all for partnerships, but of course, then it would become a question for the media in terms of, you know, making sure that you have NGO-friendly rates. So I would advocate for that for my fellow CSO organizations. And, you know, okay. I hope everybody hear that. To hear we just said that can be arranged. But, you know, I think in all seriousness, it is important to recognize that, you know, we're all for making sure, I believe, you know, people would love the opportunity to raise awareness about health and wellness, especially, you know, when we think about NCDs as all incorporating, not just physical health, but also mental health. And we're recognizing that a lot more as well. And so, you know, those partnerships are definitely encouraged. And we take the point, you know, in terms of there being more stories. Definitely happy that you were able to join us this evening and you said yes to the invitation, because definitely agree that, you know, having more airtime and making sure that we can connect and have more of these conversations so that we can promote the messaging and help to get it in the airways is very important. So thank you so much for your contribution there. Now, we know you know, in terms of what organizations are doing, we have Pastor Webb. You know, I think in your feature earlier, you kind of mentioned a couple of things that the church is doing, and I know that you already use the media when it comes to trying to promote healthy living and healthy lifestyle. So just tell us a little bit about what the church is doing, what the Evangelical Association is doing, and how you already utilize the media to try to extend the message beyond, you know, your Sunday services in reaching out to members to make sure that we hear the message and how it can connect to spirituality and the work that you're doing there.
Yes, let me also make mention of Dr. Pierre made a very valid point in terms of if we are going to fight these kinds of diseases, it's going to take a cohesive, collaboration of the NGOs, you know, non-government organizations, etc., to come together, mobilize together to combat these diseases. But from evangelistic point, from the Evangelical Association as a faith-based organization, I go back to the Bible. The BIBLE, which means basic instructions before leaving earth. And the Bible shed light on human nature, world problems, and human suffering. So the prophet Hosea made a valid point in the Bible. In Hosea 4:6, he said, "My people are destroyed because of lack of knowledge, not because of lack of information, but the rejection of information." So if we are going, and I think it's Dr. Carty that also made a valid point by making mention of 3 pillars, you know, in which one can do in order to help combat these diseases. And one of the points that she made mention of is, one of the pillars is eating healthy and also exercising. So from a church standpoint, we have been promoting healthy lifestyle, just like waking up in the morning, brushing your teeth becomes a lifestyle, and let eating, healthy becomes a lifestyle. So we promote eating healthy as a lifestyle by using backyard gardens. Of course, right now, I got involved with a backyard garden. Well, it's at the front, but it's still a backyard garden, but I have my backyard garden at the front. But, the sister in the church has been going around and promoting agriculture by promoting backyard gardens. And so even in one of our churches over there in Keyon, we have a backyard garden where we plant various vegetables and fruits and so, and we try to encourage people that your body, as the Lord said, is a temple of the Holy Ghost, so one has to be careful to what you're putting in your body. And so we promote healthy lifestyle by using backyard gardens and stuff like that. And also we use the media where we have a health program and Dominion Radio 91.5 on your FM band every Tuesday morning from 9:15 to 9:30, and we promote a healthy lifestyle. And also I have a gym too, and we talk about how we are to exercise and keep your body fit and stuff like that. And so we talk to people about eating eating healthy. You don't, when you come to the gym, we tell you that you don't lose weight in the gym, you lose weight in the kitchen, because that's all what you don't put out in the gym, and then you go and go eat unhealthy. It wouldn't speak volume. You're not going anywhere like that. And so we promote water, because your body is made up of over 70% water. So we encourage folks to drink, lots of water. Not only just drinking water, 8 glasses a day, but we promote drinking water at the right time is what maximizes effectiveness in the human body, which means when you wake up and you drink a glass of water, what happens is activate your internal organs because you are sleeping. We promote in the church that you should at least drink a glass of water a half an hour before you eat anything, because the water not only help the digestion and help you from constipation, because Caribbean people don't chew their food properly, so the water helps the digestion, and so we encourage them to drink a glass of water before you eat a meal. And we also encourage them that while you're eating the meal, it is instead of just eating and drinking, allow your body to consume the nutrients of the food that you're eating, and then you drink something afterwards to wash it down. But we also promote instead of something cold, because we believe that coldness clogged and it equal to cancer and stuff like that. So we promote drink something room temperature, a hot soup or something of that nature, so that what you're consuming would not be of any effect to the body. So I believe that as a church, we are promoting a healthy lifestyle in terms of backyard gardens and eating healthy and exercise.
Yes.
Yeah, so we does that.
Great. Thank you very much, Pastor. Really good to hear how, the church is very much involved in this. And you yourself, as a pastor, as a spiritual leader, actually setting that example. You, as you say, you have a gym and you obviously practice what you preach. I think you look well, you look very fit and well. So, it's obviously working for you. So thank you very much for your leadership, and it's really good to know. I'm just going to take a little moment to let the audience and listeners know that we will be accepting calls and questions. If you want to call in, the numbers are 466-2666 or 662-8674. 767-4765, and internationally it's 1-239-645-1500. So again, if you want to call in and join the conversation, share a comment, or have a question, it is 466-2666 or 662-8674 or 767-4765, or internationally 1-239-645-1500. So we'll leave that there, and then I will jump to our youth advocate, Mr. Bell. So you've heard a lot here from everybody in terms of, the different ways that different sectors are playing their role. So, I know as a youth parliamentarian, youth parliament, you often do debates, and you often, contribute to different topics. You're often on Inside the News, and, sharing views in terms of what you believe government or policymakers should do or could do when it comes to promoting certain shifts or changes in society. So what are your thoughts on, what do you think policymakers could do or should do to promote healthy drinking and eating? So previously I would have mentioned, just like Dr. Cathy iterated, some different policy options that have been considered when it comes to, either banning the sale and marketing of certain unhealthy goods, implementing certain consumption taxes. What are your thoughts on views on some of these things? Do you have any there?
Well, honestly, most of the problem we face with these policies are that unhealthy foods are very much cheaper than healthy foods. Mm-hmm. And the problem we have, if we don't tax the unhealthy foods, then youths especially gravitate to something that they can afford. And as Dr. Pierre would have stated, it has become a award system for them. So every time they do something good, they get something sweet, or get some junk food or something that they like. And if that keeps occurring, then what would happen when this young person is able to provide for themselves? Mm-hmm. So if the policymakers can implement taxes upon unhealthy food to kind of discourage persons from going down that lane, then it would cut the amount of effect that we have of young people developing NCDs, mm-hmm. and it would help to boost our own economy, because now that we cut the risk of NCDs, these young people can actually work for longer time, which can actually put more money back into the government's pocket. Mm-hmm. Mm-hmm. Another way that policymakers can actually implement is subsidize the cost of healthy foods, because mm-hmm. one of the problems is that people can't afford the healthy foods. Mm-hmm. And if the government chooses to subsidize these costs, then it will automatically help people to more gravitate towards these foods. Because, okay, if I'm going to buy something here and I will get a little price off, of course I'm going to buy it. Because we know when these supermarkets have their sales and what's not, mm-hmm. these things disappear off of the shelf very fast. Mm-hmm. So if the government subsidizes the cost of healthy foods, then that is the same effect that it's going to have. And also, I do strongly believe that government needs to develop and invest in the physical education aspect of the schools, mm-hmm. to encourage young people to actually exercise more and be more active as they come along. A lot of our young people are nowadays, we trying to have them exercise, and they're coming up with excuses, or they're asthmatic, this and that, and these are reasons why they should exercise, mm-hmm. but they don't see it that way. They see it as fact, these are reasons for me not to. Mm. So if we encourage them to be more active, the ministry encourage them to be more active and help to limit the cost of this NCD epidemic, then it would probably help us a lot in that aspect.
Great. Well, thank you. You definitely made a great point there when it comes to, I think we can all agree that when it comes to, I think, and this is a global trend, global phenomenon. Wherever I've gone, I've lived in a few places in the world, and the healthier option is always the more expensive option. And you kind of have to wonder why. I don't know. But it is a global food system problem. And, I do definitely agree that, if there are opportunities to subsidize healthy foods, that we should definitely take it, because one of the issues that we know that we face, and especially, as both Dr. Pierre and Dr. Cathy mentioned, it's, persons in the lower economic strata who are most susceptible to developing NCDs. And you typically, they develop the NCDs, and then they don't even have the funding or, the budgets to be able to care for themselves. But from the outset, they don't actually have the money to actually afford healthy food. So it's kind of a, it's a lose-lose kind of situation. And so I do believe, when we talk about connections and collaborations, I think even within government and our sectors, agriculture needs to talk to education needs to talk to, we often operate in silos, but we need to begin talking to each other to find ways of how we can actually make healthier foods more affordable and accessible, because that is certainly one of the challenges that we find, that the research does show, that, when it comes to accessing healthy foods, it is a challenge. And then I think, Jelani, you mentioned, even in the schools when it comes to physical education, I think, part of culture change is obviously education and information and awareness. And, Pastor Webb highlighted, the challenge is not that, information is not available, but it's knowledge and the rejection of that knowledge. And so I do believe, health and wellness curriculum is very important in our schools. And I do believe there is a small aspect of that. But when it comes to promoting healthy lifestyles, I think it definitely needs to be something where we educate and inform from very early on. So the messages that we have around the dangers of sugary drinks, which is part of the You're Sweet Enough campaign that Lake Health and Wellbeing is executing, is to make sure that messaging is also going into to not just the adults and the public, but also as part of our education for our younger generation, so that they understand what it means. And, not only to have backyard gardens in our churches and in our homes, but, why not in our schools as well, so that we begin to cultivate that kind of relationship with food and the things that we consume. I think that's really important. So I just want to remind everyone we are inviting engagement from callers. We have about 15 minutes left before we wrap up. So if you're interested in calling in or sharing a comment or sharing a question, please feel free to do that. The numbers are 466-2666 and 662-8674. 767-4765, or internationally 1239-645-1500. So as we kind of wrap up, and we're kind of coming to the end of the panel, I want to thank everybody for their contributions. I do believe we've had some very healthy debate, well, not debate, but discussion, which has been very good. I kind of want to go back to you, Dr. Cathy. We know that this panel discussion is actually part of the SKN Move 7-week campaign that is currently ongoing. We are at week 4, which is the You're Sweet Enough Drink Water Week. And so we're promoting and encouraging persons to drink water and show their body some love. So, but can you tell folks a little bit more about the SKN Moves initiative and the 7-week campaign, or at least what the next week is intended to bring? Are you able to give us a little bit more information about that and what the objective is with that?
Okay, sure. So as I mentioned before, the SKN Moves initiative is built on the 3 pillars: healthy eating, engaging in physical activity, and health screenings. As part of our SKN Moves anniversary for this year, which is celebrated around August 9th, we decided to implement a 7-week campaign, taking into consideration as many of programs and activities that incorporate those 3 pillars. And we started with our breastfeeding week during the first week of August, which is a part of that healthy eating from an early stage. Breastfeeding our children is actually one of the measures that can help to reduce the risk of our adults later on in life developing chronic diseases. And then we went on to our SKN Move celebrations during the 2nd week. And then in the 3rd week, we took another look at healthy eating again with our In Your Kitchen cooking competition, which I do believe that came off pretty well. A lot of persons indicated that they enjoyed that live cooking competition with one of our good hosts, Sugar Bowl. Now, as we move forward with the 7 weeks, This week, as you mentioned, Iselene, is our Drink Water Week, where we are encouraging persons to drink healthily. We've always been speaking about eating healthily, but drinking healthily is also important. And a part of drinking healthily is also avoiding the use of alcohol as well. So that's also a part of healthy drinking. In the weeks coming up, so next week, we're going to be taking a look at mindfulness, the ability to be present within your health, and just being able to, look at all of the issues that come up as it pertains to mental health as well, in that whole idea of mindfulness. So that's what we're going to be looking at next week, our Mindfulness Week. And then following that week is our Self-Care Week. So during that week, we're actually going to be sharing some of those techniques and tools from the Chronic Disease Self-Management Program, which I mentioned earlier, which I said is a community-based program where we help persons living with chronic diseases and their caregivers to be able to better manage their condition. So during that week 6, we will be sharing some of those techniques and some of those tools that persons can use to be able to do this. And then in our final week, as we wrap up the 7-week campaign, that week is actually our Caribbean Wellness Week that is celebrated every year. The second Saturday of September is usually Caribbean Wellness Day. This is actually a day that was established out of the Port of Spain Declaration of NCDs that was established in 2009 by our CARICOM heads of government. And so on that day, we will be having a panel discussion where we are going to be looking at persons living with chronic diseases and how those conditions impact their lives, and are looking at some of the other aspects and the other stakeholders that are involved in helping persons live with chronic diseases. And then following that, we'll have on the Tuesday, we have our National Fruit Day. These activities are also part of the Independence celebrations, and so we are happy for that. And then finally, to wrap it all up, we have our Sneaker Day and Soca Size on the 17th of September. And so I think so far, the 7-week campaign has been going well. We've been engaging the public have been participating in our activities, and we just want to ask you to continue to participate as we continue with our rollout of the 7-week campaign during weeks 5, 6, and our final week, Caribbean Wellness Week, week 7. Thank you.
Thank you so much, Dr. Cathy. I agree with you. I think I was watching the cooking competition for a little bit. I thought it was very, very, very good. I learned a little bit. And Sugar Bowl is always funny. He's always uplifting. So thank you very much for that. And just for persons to look out, so like I mentioned, we're in the 4th week, which is our Drink Water Week. You're sweet enough, encouraging people to avoid any sweetened beverages. And there's a challenge that is ongoing. So we're definitely seeing a lot of engagement, and we appreciate the public engagement over the course of all the different weeks of this campaign. So thank you very much. Your engagement is appreciated, even for tuning in this evening. I just want to kind of plug that there is one more event and activity taking place during this week, which is the You're Sweet Enough Week. Tomorrow we have a film screening with a small discussion on, it's a film about childhood obesity. It's called Generation XXL, and that is hosted by Lake Health and Wellbeing through our Zoom platform, but you can find information about that in the link to register. It is online. It'll be done virtually, so you can find information about that. Check out our Facebook and social media pages. So that's Facebook, Instagram, or even our website at lakehealthandwellbeing.com. So you can find us online and register for that film screening, which will be happening. That's tomorrow evening, 7 to 8:30, and it's a film that we'll screen, and then we'll have some discussion leads who will talk a little bit about some of the themes from that film. So thank you all very much for that support. Now, as we wrap up, I want to jump over to Dr. Pierre, who always nice to hear from, and hearing your passion about all of these things that we're doing. So what are, your final words, Dr. Pierre? You definitely mentioned some things, that we've heard from different persons in terms of the work that we see that they're doing and suggestions for collaboration. What are your final thoughts around what we can definitely do moving forward and how we can continue to engage and continue to do more of these things? What are your concluding thoughts that you want to leave with us tonight?
Thanks, Iselin. I think my concluding thoughts would be to just summarize that I think we've given people a lot of information, and I usually say when the calls aren't coming in, it's because people are busy taking notes, and I think this is so consequential for anyone listening. So I imagine people are at their home and they're glued to the TV sets or their radios, and they're listening to the information here. I think you put together a really great panel to discuss this. Of course, 1.5 hours is certainly not enough time to discuss something as consequential as this. But I think I just want to summarize this by saying, from my end, I think we all have recognized, we either know someone in our family or we know a family member where we have seen the economic impact of a disease. What happens when somebody gets a cancer diagnosis? What happens when somebody gets a heart attack and perhaps need a triple bypass grafting, which can set you back $100,000 US? It's essentially, NCDs continue to increase that type of income inequity that already exists in so many societies. It will quickly deplete household wealth and increase health spending, while at the same time lowering labor productivity. So if you think of it, if you think of those things, you increase income inequity, deplete household wealth, increase health spending, and lower labor productivity. It is almost impossible to build a nation with those things being a constant threat to any sort of development agenda that you may have as a developed society. I think it's also important to note as well that, and I spoke to the health burden, and I said that, health burden, if I were to summarize it, would be what is not just what is making us, what is killing us, but what is making us sick. Again, infectious diseases, if COVID wasn't a thing, we wouldn't be thinking of any infectious disease that is really an existential threat to us. So right now, it's not about what's killing us. We have done a great job as a world. Look at what we did with vaccines. We came up with a vaccine in a record time when the world came together behind this disease, coronavirus, right? The COVID-19 pandemic. So the world comes together quite nicely, but the world now has a sort of a moral injury. There's a sort of a battle here between, pushing big business, right, and big business agenda and getting jobs for everyone, and at the same time whilst trying to keep people healthy. So this moral dilemma that the world has found itself in has resulted in us now living with more health problems that's causing pains, impairing our mobility, preventing us from seeing, from hearing, and thinking clearly. This is where we find ourselves, and we find that fewer and fewer people are walking around the streets of Basta in good health. Those are the sobering reminders. And as a medical practitioner, as I said, we do our bit when we can, but I believe that the healthcare that really works is not the one that treats a disease, is the one that prevents it. In my 14, 15 years, when I practiced actively in emergency room, I would tell all my team when they came together, I said, guys, problems are best avoided than solved. And the same goes for those diseases. I think we need to come together, and it's not by any stretch of the imagination a simple thing to solve, as I said, but it is not insurmountable. I believe over time we can make those changes, and I believe we can get there. And I think it is imperative that we work together towards policy change and sort of and lifestyle change that would actually see the impact of this and the ripple effect of those changes downstream. So thanks again for having me on the show. I truly appreciate it.
We'll wrap up our discussion this evening and reminding us, I think we've heard definitely from everyone on the panel. I'd like to thank everyone. Thank you, Dr. Kachi, Dr. Pierre, Andre Huey, Pastor Webb, and Jelani. Thank you all very much for joining, because collaboration is absolutely important, and collaboration is central to the work that we do here at Lake Health and Wellbeing. And so it's really important that we all continue to work together to see and to find ways that we can prevent the development of non-communicable diseases as Dr. Pierre reiterated, having been working on the front line. And, I just want to encourage people, so that's part of what SKN Moves is all about. Prevention, as Dr. Cathy mentioned, is a major factor. So I'd like to encourage folks, if you haven't already, please check out the SKN Moves website, where you can find all the information of the different activities and the different weeks that we have ongoing in terms of the activities that are unfolding as part of the campaign and the movement. Remember, next week it's about mindfulness and mental health. Remember that when it comes to mental health issues, those are also considered a non-communicable disease when we're talking about things like chronic anxiety and depression. So bear those things in mind, and we continue to work together and have these conversations and spread education and awareness. And I think we have commitments here from obviously persons working in the media, persons working in the church, and obviously from youth advocacy and development. And of course, the government is always here, and we know our medical practitioners are always at hand. So we'll continue working together, and you'll continue to hear more from us. So thank you all very much. If you're listening live via ZIZ TV, YouTube, Facebook, thank you for tuning in. Thank you for your attention and your audience. It's most appreciated. Thank you. Good night.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese, and 28% of children